Throughout history, people have strived to improve themselves and their ability to experience enjoyable and full lives. One such example is the coming about of cities in places like the United States, which have been statistically proven to improve productivity and increase the presence of available jobs. However, more often than not, people do not take into consideration the potentially harmful effects of urbanization on human health. Issues such as air pollution, noise pollution, and water scarcity in cities are just some of the prevalent problems. Yet, many of these issues can be properly dealt with through increased education and awareness, which sometimes might not always be well known simply due to a lack of emphasis in everyday education. In this documentary, we will ask three students of Boston University a series of questions and see how much they know about urbanization issues. What is urbanization, in your own words?
Um, I would say that urbanization is the spread and building of cities in a country and in the world. So you think of the word urban and you think of cities as opposed to rural. So it's kind of the building up and commercializing of an area.
Urbanization is, I believe, it's when cities develop instead of becoming, like when they develop the roads, all the infrastructure in the city, the sewer system and all that, so that everything becomes accessible and it's easier to use.
Not really sure. I think that's just when people move into an area and make it an urban area for people to live.
Yeah, so the direct definition is the act or fact of urbanizing, which in other words is the taking on the characteristics of a city.
The first that comes to mind is the air pollution that occurs in cities. So any chemicals that are in the air, or just air in general that isn't dirt, like that's not dirty, isn't clean, can cause problems like, asthma, but also just it can cause infections, it can cause lung problems, and just general breathing issues. I can also see an issue with closely packed areas of living, like apartments or tenements, places that there's a lot of people. It's an easy way to spread germs. People are in close contact. So I think those are the two main things that I would say.
I think the first, like the biggest deal would be issues with our respiratory system. Since when cities become urban, there are usually lots of cars, lots of factories. That affects the air, and it probably causes lots of health issues that affect our respiratory system, I would say. Things like asthma and all the other stuff that, breathing problems.
Anything pollution related, I guess, with cities comes factories, people living, burning, releasing toxins, any sort of pollution that comes from us living in our standard of living here. So, I don't know, anything related with oxygen intake, I guess.
So you think like respiration? Or?
Yes, yeah, respiration.
Respiration issues, yeah. So one of the main ones is asthma, and then there's also things like cancer, because of carcinogens, like you were saying, and then heart conditions, actually, because of things like sitting in traffic. There was a study done where they actually found out that sitting in traffic for an extended period of time actually increases your risk for a heart condition.
Maybe like 30%.
Actually guess more than 100%.
I guess around 30-40%.
It's actually over 75% increase in prevalence
That's
since
a lot more
1980.
than I would expect. Okay.
So, percent.
Ooh,
Yeah, making it one of the most prevalent chronic ailments among young people in the country. And 13% of all American children under the age of 18 have been diagnosed with the disease, and the prevalence is even higher in some other developed countries. So it's kind of a scary fact.
Yeah.
Okay. It's a surprise.
Like 3-6, now I'm feeling so fly like a G6.
I would say true.
I would say true.
True.
And you're right, it is true. A recent study by Cornell University found that first and second graders had difficulty learning in an environment whose school is located within the flight contour of a major New York metropolitan airport.
Very interesting.
Interesting.
I would say it's showers.
I would guess that would be shower.
If I had to guess, I would say home use, specifically sinks, dishwashers for cleaning specifically.
It's actually not. It's flushing the toilet.
Are you serious?
Yeah. Yeah.
Wow.
And their EPA guidelines, it's 1.6 gallons per flush, but even with that guideline, there's still a lot of water wasted. It's the number one
That's
wastage
incredible.
of water, yeah. Yeah.
No, I don't think so.
No.
It's actually a program they're trying to help curb the waste of water by reusing some not entirely clean water. So, for example, taking a shower, the water is not necessarily totally dirty, so they bring it to a treatment plant, and after they bring it to a treatment plant, they then bring it back to your water in a separate pipe, and it's used for things like your toilet where you don't necessarily need fully clean water, or like sprinkling the grass. So it's not drinkable, but it's still clean.
Yeah, that's good.
I think it's cool. I mean, you don't really need clean water to flush the toilet. As long as the water is not smelly and it doesn't make the toilet smell, it should be fine.
That's really neat, actually.
Yeah.
I would be interested in that kind of program.
Yeah, I think it'd be cool to have in Boston.
I think it'd be cool to attend. I mean, it might be tough to get a whole city on board at first, but I think it'd be something to start.
Yeah.
Yeah.
As can be seen, many of these students have both the interest and some of the knowledge necessary to make a difference in issues relating to urbanization and human health. Further awareness and education are key to making a positive change, as urbanization has many benefits that can be reaped, but it is up to everyone to help prevent avoidable health problems that come along with the development of cities.